Hello, friends. Welcome back to Pristine Smiles. Do you know, pristine refers to something that's in its original condition, clean and fresh. Pristine gingiva or pristine gums is a state of super health, where the gums are free of any inflammation and they do not show the presence of any bacteria. The ultimate goal of any periodontal treatment is to get the gums as close as possible to the pristine state. But that's not always possible, right? So we have the next best thing, clinically healthy gums. The clinically healthy gums, they look similar clinically to pristine gums. But if you take a section and put it under the microscope, you will notice inflammatory cells. This is absolutely normal. Clinically healthy gingiva is absolutely normal. In today's video, we will see why gum health is important for overall oral health. So let's begin with a bit of an anatomy lesson. This you see here is the tooth. So you now see that the gums are present surrounding the tooth. These gums hold the tooth in place. Let's check the lateral section. You see these colorful fibers? These are the gingival fibers. These fibers attach the gums firmly to the tooth. They provide strength to withstand the biting forces without being deflected away from the tooth. So these fibers hold immense importance in holding the tooth in its place. So what if these fibers get weak? Guess what will happen? You're right. That is the beginning of gum disease. Here we have a healthy tooth. The gums are all firm and pink, no bleeding, healthy gums, healthy tooth. So say now you have forgotten to brush your teeth, or there is some reason that is preventing you from maintaining your oral hygiene efficiently. And then you start noticing tiny white layer covering your teeth, and the gums start appearing red, swollen, and may even bleed on brushing. This whitish or yellowish structure is the plaque. You can find it anywhere in the mouth. Tooth surface, surface of a filling, even on removable and fixed dentures. The plaque is a matrix and it cannot be cleaned by rinsing your mouth with mouthwashes. The physical action of brushing, that is using a toothbrush and a toothpaste, is what is needed for effective removal of the plaque. So what happens if you leave the plaque as it is? We have two types of plaque. Supragingival, that is the plaque which is present above or at the gum margin, and subgingival plaque, that is the plaque present between the tooth and the gums, that is below the gum margin. Now supragingival plaque is what is responsible for initiation and development of gingivitis and root surface cavities, whereas the subgingival plaque is what causes tissue destruction and causes periodontitis. Now this plaque can be removed by brushing properly. Now if this plaque is left behind, it gets bathed in the minerals from the saliva and gets mineralized. It becomes hard, and this is what we call calculus, or in simple terms, tartar. So why is this calculus bad for us? The tartar has a rough surface, so it allows the plaque to attach to the surface. This plaque gets close to the gums, causing inflammation. Then this plaque over calculus may be difficult to remove by brushing. And sometimes a part of the calculus may detach, lodge itself into the gums and prevent drainage, which causes a gingival abscess to develop. So now that we have established that having tartar can cause more problems, there are two ways out here. Either don't allow calculus to form, so all you need to do is follow the right brushing method and brush twice daily. Now, what to do if you already have tartar formed? Not to worry. Visit your dentist, who will use a special instruments to remove the tartar as well as other irritants that attach to your tooth. The sooner you get this dental issue addressed, less damage it's likely to cause and less expensive it will be to treat. So, what damage can this plaque and tartar cause? You will start noticing that your gums have started appearing reddish or reddish blue. They will start bleeding on brushing. The once firm gums become soft, shiny, and smooth. You may also notice a change in the position of your gums. They may appear swollen. This is what is gingivitis. A mere 2-day presence of plaque is enough to cause gum bleeding, but it may take up to 7 days or more of continuous oral hygiene measures and treatment to eliminate gum bleeding. The plaque attached to the gums causes inflammatory changes. The gingival fibers start getting weaker and the gums start separating from the tooth. This causes a pocket between the gum and the tooth. The gums start moving apically. This brings with itself a whole lot of dental issues. Gum bleeding is already present. Along with pocket formation, there may also be pus formation in the pockets. Sometimes food gets stuck in there and it may cause a bad breath. Teeth start getting loose. Spaces start to appear between teeth. Bone loss occurs. This is what we call periodontitis. This may need deep cleaning along with a periodontal flap surgery with or without adding bone graft material, depending on the clinical situation. Sometimes the condition is very bad. The tooth gets extremely mobile. Large amount of bone loss has occurred, and the only thing that can be done is the removal of the tooth. This is advanced periodontitis. Many people don't realize if they have gum disease as it's occurring below the gums. Gum disease is a major dental health issue that unfortunately not many people are aware about. It also increases the risk of many other health issues such as diabetes, stroke, heart disease, etc. So, if you develop any of these signs, be sure not to ignore them and get yourself evaluated by a dentist. Thank you for watching.